Welcome, hello, to the digital town hall conversation that we're hosting on the Lieutenant Governor's office. I'm David Zuckerman, your Lieutenant Governor, and each week we're going to spend half an hour or so talking to guests about an issue that's being discussed here in Montpelier. There's often way more being discussed than you sometimes see on the news. Sometimes folks say, you're focused on one issue, that's all we hear about in the news, but really between the House and Senate there's 25 committees, there's constantly various conversations going on, and we just try to bring up some of the topics that happen, sometimes that you do know about, sometimes that you don't. And today, feel very fortunate to have a couple great guests. The first person I'm going to introduce, well, I'll introduce them both, and then we'll turn to Lucy Larish, but she is the Vice President of Public Affairs for Planned Parenthood of Northern New England. And we have Representative Barbara Rachelson from Burlington, who serves on the House Judiciary Committee, and it'll become apparent why we've got Barbara in here in just a moment. Today is the 46th anniversary of the Roe v. Wade decision of the United States Supreme Court. It's the landmark decision which legalized reproductive freedom and abortion access for women across our country. It used to be some states and not other states, and this created a uniform law across the country. And today, being that anniversary, is a day that often Planned Parenthood comes to the State House, brings a number of advocates and young folks and older folks and people that care about reproductive freedom to the State House, both to celebrate that court decision, but also to really help inform people how to be advocates for this issue. So maybe if you're willing to help talk a little bit about why is it important for people to still advocate on this issue, that would be great.
Yeah, thanks. Well, I wish it were no longer necessary to advocate on this issue. As you mentioned, Roe was decided in 1973. It was an awful long time ago, and here we are. Fast forward to 2019, and we have the Trump administration, 2 new justices on the Supreme Court who have pretty much promised to alter abortion rights. And there are a number of cases circulating in the lower courts that could make it to the Supreme Court and have the effect of affecting abortion rights. So our advocates are here to support the legislative leaders in this building to codify abortion rights in Vermont, to make it clear that in Vermont, women and people who identify as women, people with uteruses, have the right to safe legal abortion, and that we will make an affirmative stance on that. And in addition, put in our state constitution that affirmation that reproductive liberty is a part of our civil rights.
Right, and did we just last year also change our laws a little bit to remove some of the language that was in place prior to the Roe decision that actually had some restrictions, correct?
Yeah, there used to be criminal penalties for physicians who would perform abortions. That was on the books. The Supreme Court overturned that decision. That was the Beecham v. Leahy decision. But that law was still in the books. So as a matter of housekeeping and a point of principle, the legislature rightly decided to purge that particular provision from the books.
That's right. And so you were just discussing how we're discussing here in the State House. I think the discussion will start in the Senate, but eventually a constitutional amendment is being proposed. It's been proposed to codify in our Constitution reproductive freedoms, women's autonomy and control of their own bodies, and so that is a process that goes through the legislature. And you are on the Judiciary Committee. Can you speak briefly about that process, but really also the importance of looking at this kind of language?
Sure. So one thing that's very interesting that I've discovered is people confuse having a constitutional change at the state level versus the federal level. Mm-hmm. And even Saturday when I was at an ACLU board meeting, there were people that were nervous about constitutional change. So I think one thing that's really important is for people to know Vermont has a very thoughtful, long process that is very specific. So it is not like having a national constitutional convention where anything will come up. So basically, as you said, it needs to start in the Senate. It has to pass both houses, and I think by a certain percentage.
On the Senate side, it needs 20 votes, yeah. And on the House side, it's a majority.
Okay, great.
The first biennium.
The second biennium needs to pass both chambers by a majority.
So that alone is a best case scenario, 3-year process?
3-year process, yeah.
Probably 4, right? Then it goes to the voters of Vermont to affirm.
Yeah.
So it's not a willy-nilly process, and it's something that I'm sure all of us have heard how important it is to so many people, and something that's of value to Vermonters. I know my constituents care a great deal about this issue. I certainly heard about it going door to door. I also should say that when I was in my young 20s and did not live in Vermont, lived in another state, I ended up being pregnant and was trying to go through this process. And it turned out, as I was trying to go through the process of deciding if I could go ahead and support a child, it was determined I had a blighted pregnancy, and the doctor that I was seeing did not support any kind of ending pregnancy at all, and basically said, you're gonna have to wait this out and give birth to pass a blighted pregnancy. And there was a lot of shame and trying to find out what my options were, and it was pretty awful. And I just think about going back to, and again, it was after this decision was legal, but we do not want to go backwards. We need to make sure that people have access to their options, that they have access to safe abortions. We've all heard horrors of people having homemade ones, and that would not be a good thing.
First, thank you for sharing. That is deeply personal information, and I appreciate you sharing that with us, but also sort of with us. It's everybody, and
awesome.
It's hard to do. And I think we were talking earlier about advocacy, and part of advocacy is sometimes telling your story. And a lot of our stories can sometimes be difficult and challenging, but it's these realities that are what are being decided by the policies and or constitutional amendments that are determined in buildings like the Vermont State House and 49 other states. And I think relative to both your experience, but also talking about a constitutional amendment, one piece that I think is important for folks out there to be thinking about is to make an amendment is a long, many-year process, like we just said. It's also not something that you then change easily. You have to go through that whole process again. So sometimes we pass fairly significant legislation, the laws of the state, and you pass a really big piece of legislation. Sometimes it has some parts that turn out not to work exactly the way they were intended. And so the legislature can revisit the issue and make adjustments and fix things here or there. With a constitutional amendment, you don't really get 2 bites at the apple, for lack of a better term.
Exactly.
And so there's a lot of responsibility on legislators like yourself, on the House Judiciary, and yourself in the Senate Judiciary Committee, to really parse over these words very carefully, make sure and I'm sure as advocates, you'll be looking at that language very closely to make sure there is not something codified in our Constitution that is restricting in some way or another, or could be interpreted to be restricting. And so there's a lot to that, and I would say, back to advocacy, folks who care about this issue, frankly, whatever side of this type of issue or any issue that you're on, you've all heard me say this before, but reach out to your legislators. Talk with your elected representatives and senators. Let them know how you feel, ask them where they are, offer them information, because we are only as strong as the sort of collective input of Vermonters all across the state. And there are many people outside the building who have various personal experiences, similar, different, and otherwise than the one you've just shared. And sometimes some policymakers don't even know that kind of thing happened, even in this day and age. And so if you feel more comfortable in a private conversation over the phone or in person with your legislator, I really do value and thank you for your public telling of this. Legislators should keep these things private or at least anonymous if you ask them to, and they tend to really respect that. And so with this information, I really want to just go back to that and say, share your experiences, share your input with legislators. So, Lucy, one of the things that Planned Parenthood offers is so much more than abortion, right?
Yeah.
Sometimes there's a focus by some politically to say this is what Planned Parenthood does, and therefore Planned Parenthood is bad, for instance.
Right.
That's
Right.
a paraphrasing of some people's words. My understanding is that abortion itself is actually a very small percentage of the work, and that there's a huge amount of work around reproductive health and discussion about preventing, which to me, when I look at the name Planned Parenthood, the idea is planning when you're going to be having a family, as opposed to the world of unplanned pregnancies and then the challenges that comes up with in relationships and everything else.
Yeah.
Can you talk a little bit more about what Planned Parenthood does in a broader sense?
Absolutely. But before I do, I just
Sure.
want to say first, thank
Please.
you, Representative Rachelson, for sharing your story. This really dovetails very well. Part of our advocacy efforts at Planned Parenthood this year with codifying abortion rights in Vermont law and also putting the civil right for a woman to determine, for a person to determine her own life's course and have reproductive liberty includes also a campaign to combat shame and stigma, abortion shame and stigma. 1 in 4 women by the age of 44 will have an abortion. That means that an awful lot of people have had this experience. We have been convinced to be ashamed or to internalize the stigma, and I just want to really celebrate you, Representative Rachelson, for having the courage to just come out and tell your story. And we encourage all of you, all of your listeners, people out there, to do the same, because it's only through pushing back at the opposition and the shame and stigma will this go away. Women have been in this corner long enough. It is time to push back.
Can I add to that as well?
Absolutely.
I know when my spouse and I were trying to have a child or children, there were also a number of miscarriages, which is another one of those conversations that is somehow in our society we've made it shameful, and that there's something wrong or broken or anything like that, which none of which is true. Miscarriages are extremely common, more common than that is my understanding. I don't know the exact numbers. So that too is about having honest conversations about just reproductive health and what happens to all of our bodies, male and female, as we go through life and go through these different experiences. So I sidetracked you from it to say there's more than just choice and abortion that women end up feeling shame for, whether it's body image, whether it's miscarriages, abortion. So I hope people hear, at least from I think all three of us, that there is no shame in any of this.
And frankly, it seems important that, I mean, when I was interviewing doctors, you know, and I don't think I did, I think I got a recommendation from somebody, that wasn't a conversation I had of like, should I ever need to end a pregnancy, is that something you would support? So being pretty young and not being able to separate out sort of this doctor not making those recommendations and realizing, oh my gosh, like this, like how long am I gonna go before I might have my blighted pregnancy? Like, because that's kind of a weird position to be in. And so part of it too is having open relationships with doctors about what they are willing to do or not do, and not having to sort of find it out by happenstance. So again, we have a lot of misinformation. We think Planned Parenthood is an abortion factory, which it isn't. And we think that doctors will present you with all your legal options, which they don't always.
So that's a great segue. It's a great segue to your question, Lieutenant Governor. So Planned Parenthood offers a full range of reproductive and sexuality health care. So we do, the vast majority of the work that we do is around prevention of unwanted pregnancies, so contraceptive counseling, IUD insertions, and so on. We screen for sexually transmitted infections and treat sexually transmitted infections. We do well woman and well man exams. We are We have very successfully moved into the area of trans care, so transgender individuals can come and get hormone therapy and get care from us. We have obviously cancer screenings, breast exams, the full range of reproductive health care, and of course abortion. And we do not back away, even though there aren't a lot of people who come to us seeking abortion, we do not back away from being a proud provider of abortion to allow people their full range of options. And we also ethically are standing firm with our patients, and we let people know that we provide compassionate, non-judgmental care. And one of our taglines is "Nothing will freak us out." So we are a safe place, and we will provide health care to everyone, and we believe access is very important. A very large percentage of our patients are low income. We have almost 47% of our patients have Medicaid. So we provide health care to people with modest resources, and we also provide free care and a sliding fee scale for people who come to us without any insurance at all.
And this organization is across all of northern New England, the 3 northern states.
Yes.
But specifically to Vermont, how many clinics and healthcare facilities do you operate? Because I know there's a fairly robust one in Burlington,
Yes.
but I think you might have 1 or 2 others around the state. But I still sometimes wonder about sort of rural access versus urban, and as people sometimes talk about at the federal level taking money away, that really reduces the broader health care options for many, many people in rural areas where under the financial sort of capitalist system in Chittenden County, people are going to get the health care. You've got a tertiary level hospital, you've got a lot of other healthcare options, but in a lot of rural Vermont, you don't have as many options. So,
Planned Parenthood is really also very committed to access. We have 12 healthcare centers scattered across Vermont, including 2 in the Northeast Kingdom, 1 in Newport and 1 in St. Johnsbury, and Bennington, every corner of the state. And in St. Albans, that's right. So we have 20 healthcare centers across the 3 states, and we have 12 of those healthcare centers are in Vermont.
And so do some of those that are on the eastern border also serve some folks from New Hampshire as well?
They do, yes. We have
so you don't really measure borders the way that politicians do.
No, we actually don't, because that's true, because our patients come from wherever they come from, and they're welcome from wherever they come from.
And as a social worker and somebody who's worked with adolescents for most of my professional career, I know it's a place that young people feel safe accessing. And you touched on sexually transmitted disease, which is huge. The numbers are staggering of people who end up having very serious at times sexually transmitted disease. So the role that you play in keeping those populations safe is really important.
Yeah, from a public health point of view, taking away dollars from Planned Parenthood, that as is being attempted currently at the federal level, really does have population-wide implications. A lot of people think that Planned Parenthood receives some kind of federal appropriation because there's always this discussion about defunding Planned Parenthood. I think it's really important to talk about that for just 1 second. We see a disproportionately high number of Medicaid patients. We are committed to access for everyone. And to the extent, as you know, Medicaid is a federal program, and so that's a federally funded healthcare program. That's what they're talking about. They're talking about.
So that goes with the patient and individual who happens to go to you.
Who chooses their healthcare provider.
Right.
And so when they talk about defunding Planned Parenthood, what they're talking about is saying, you, Medicaid patient, you may no longer use your Medicaid insurance at Planned Parenthood as a way of trying to starve us, restrict providers, and so it's we consider that a hostile act, and this is something that we are definitely pushing back on in our organization, and doing everything in our power to make sure that our patients and all Vermonters have access to high quality, compassionate, non-judgmental health care.
Right. And if the federal government were to move in that direction, I think now with the House changing hands that may be less likely.
Yes.
I know the last couple of
Yes.
years was really
The relief.
a moment of pins and needles.
Yeah.
What kind of resources would that have removed if 47% of your patients are Medicaid?
It's a significant.
How would that have impacted Vermonters or other folks in northern New England? Not only those on Medicaid, but potentially, if you have less overall resources, you would have maybe had to close some clinics, maybe not, I don't know. Can you go into that a little bit, just in terms of the risk that was out there?
Well, there was a lot of risk, and I think I need to name it that there's still risk. The federal government, the Trump administration is currently looking at creating a rule we call it the gag rule. It would prohibit any Title X funded healthcare provider from referring for abortion care. So if that if that particular rule goes into effect, we will therefore, our firm understanding is that we will have to forego Title X because we would be asking our healthcare providers to violate their medical ethics. It's medically unethical they took a Hippocratic oath and they need to offer all options, and so we would have to turn the Title X away. So the federal funding fight still exists, even though at the House level of defunding Planned Parenthood, as that's described through starving out our Medicaid patients. That, as you mentioned with the House flip, is not a concern right now. What would happen if that were to move forward? It would be impactful. But I think what I'd like to do is I want to emphasize for your viewers that we are committed to, no matter what the federal government does, we are going to fight back. And whatever they do, it will be temporary because we are not going to stand for it, and we will stand up for our patients no matter what.
So we could have the situation where we have it, we get the constitutional change and we get it built in as a right, but there may or may not be places that would be willing or able to perform abortions, right? So we need to make sure at the same time it's not just a constitutional right that there's no way to
that access is still under attack, and that we can't sit back and say, oh, it's under our Constitution now, we can rest and feel secure, because depending on who's in the White House, depending on who's in Congress, there could still be access issues through funding.
And just briefly of Congress, because then we're going to have to wrap up pretty soon, but my understanding is certainly Senators Leahy, Senator Sanders, Congressman Welsh are ardent supporters of these funding sources, and have been standing with us through this. So I want to make sure viewers are aware of that as well as we talk about the role of our federal government and federal delegation in this conversation. And I hope this has been informative for many. Sometimes in the news you just get one quick quote from somebody, and this depth of knowledge is part of why we're having this series, so that you can learn a little bit more knowledge about things. Then you can talk a little bit more articulately with either your friends, your coworkers, your family, classmates, anybody you know. If this topic comes up and someone says something like, cut their money for abortion. Well, it's not cutting them, it's hurting actual individual patients with access to providers through Medicaid or other bits of knowledge that maybe you've picked up today. I want to remind you, you can get my newsletter by going to the website ltgov.vermont.gov, where sometimes we also explore some issues in a little more depth and give you resources to learn more. We have these programs at least once a week, sometimes twice, going into more depth on an issue. If you have ideas you'd like us to talk about, guests you'd like me to have on, please feel free to type in a message under the screen there and we'll take a look. As you know, in the past, we talked about issues like pro-minimum wage and some folks who are concerned about the minimum wage. These conversations can be about any topic. We like to make sure people get all different perspectives on an issue. So if you want a different perspective, let me know. And again, you can also visit this webpage, as you know, Facebook page at VTLTGov. the website, ltgov.vermont.gov. And thank you very much for tuning in, and thank you both for joining.
Thank you.
Thank you for making government so
Accessible.
We're trying. We're
Yeah.
trying.